Social phobia, more commonly known as social anxiety disorder, is characterized by high levels of anxiety and self-consciousness in everyday social situations. It is when a person is afraid of being negatively judged and evaluated by other people. Social anxiety is one of the most common and disabling anxiety disorders. An anxiety disorder causes unexpected or unhelpful anxiety that seriously impacts our lives, including how we think, feel, and act. Some neurotransmitters in the brain that are involved in anxiety are serotonin, norepinephrine, gamma-aminobutyric acid, also known as GABA. It has been shown that changes in brain activity in certain areas are involved in anxiety. It is also likely that anxiety disorders are genetic, as many of them run in families. Social anxiety disorder, social phobia, is the third largest mental health care problem in the world today. Social anxiety can affect a person's life because they constantly worry about what they are doing and how others are judging them for doing it. They fear that their symptoms of anxiety will show and that people around them will react negatively to them. Those suffering from social phobia will avoid social situations and, as a result, will miss out on many amazing opportunities. The physical symptoms of social anxiety are blushing, trembling of the voice, trembling or shaking, dry mouth, upset stomach, twitching, sweating, involuntary twitching, unsteadiness, shortness of breath, disorientation, muscle tension, and rapid beating of the heart. The behavioral symptoms are never eat in public, decline to speak up in meetings, avoid meeting new people, avoid eye contact with strangers, fear-based decision-making, problems dating, and habitual avoidance. The cognitive symptoms are unrealistic demands of self, negative thoughts about self, mind games, low self-esteem, fear, thoughts of inadequacy, and self-conscious thoughts. Social anxiety disorder is often mixed with different anxiety and depressive disorders as well. Social anxiety is only diagnosed if the symptoms of anxiety, fear, or avoidance interferes with a person's daily routine, functioning at school or work, social life, or if the person is noticeably troubled by it. There are many ways to diagnose social anxiety, one of which is the Questionnaire for Social Anxiety and Social Competence Deficits for Adolescents. This is a self-report questionnaire for people aged 12 to 19, written in German. The questionnaire is very reliable and has been created to improve diagnosing of those suffering from social anxiety. There are two main treatments for social anxiety disorder. The first of these is cognitive behavioral therapy. The cognitive component of therapy helps to change their fear-filled patterns of thinking. The behavioral component of CBT helps people to become more comfortable in situations that frighten them. This relies heavily on exposure, but only as the patient is comfortable. CBT is often accompanied by anxiety management training. This type of therapy generally lasts around 12 weeks. The second of the two treatments is medication. The medication prescribed for social anxiety are antidepressants such as SSRIs or MAOIs, and high-potency benzodiazepines. Some forms of social anxiety are also medicated with beta blockers. Social anxiety disorder accounts for 6.8% of diagnosed psychological disorders. 50% are by age 11, 80% by age 20, and 60% are women. Causes are genetic affliction, chemical imbalances, trauma during developmental phase, and learned from the environment. Causes are eating or drinking in front of people, writing or working in front of people, being the focus of attention, talking on the phone, asking questions, or giving reports, basic interactions in groups, speaking in front of treatments include relaxation, light to moderate medication, behavioral therapy, social skill training, exposure therapy, and cognitive reconstruction.